Tom Gonzales, Larimer County Public Health Director. Yeah, there's really two major objectives here for tonight. One, provide an overview on our current trends with COVID-19, and there's some concerning and alarming trends, and I'm going to have to be very honest with everyone. We're going to have to get more diligent like we were back in May and June and back in July when we flattened the second curve. And then we're going to talk a little bit strategies on how we can reduce our cases, the case rate, and prevent illnesses. And right now, currently, Larimer County is assigned to the Safer at Home Level 1 phase. That's the Colorado State COVID dial. That is a Colorado requirement, not a local requirement. But we've been enjoying Level 1 phase within the 5 phases. Protect our neighbor is the least restrictive, and then there's Safer at Home Level 1, 2, 3, and then stay at home. Unfortunately, due to our rate in cases elevating rather significantly, we are on jeopardy of losing that status on Level 1 to Level 2, and potentially, if it continues, to Level 3. And there are some certain restrictions and sacrifices that our community is going to have to make. So I'm going to go through some of the data and the trends, and then I'm going to urge our residents to again, I know we're tired of this, but we're going to have to act diligently to reduce these cases to maintain our Level 1 status. Ultimately, we want to get to protect our neighbor's status. Throughout the response, Larimer County has achieved great success based on strong collaboration and commitment of our partners, as Darren said, working very closely with all our municipalities, our hospitals, our code enforcement, our businesses, our not-for-profits, Colorado State University and Front Range Community College. And going forward, our success in maintaining our current status as Level 1 will only be successful as an entire community. Like I said before, we've rallied once in lowering our cases back in May and then again in July. We need to do it again. I'm urging us, we got to do it again. But I have no doubt we will do it again, as we've done in the past 2 times. I know we're all tired. We have COVID fatigue. But even more, we're going to have to be diligent, even more than we were in July and May as we move into the winter months. We saw this once before in July. Cases increased, and 3 weeks later, hospitalization increases followed. So it's important that we really look at social distancing. We've got to stay our 6-foot distance, wearing face coverings, even outdoors at times when we cannot maintain that 6-foot distance, washing hands frequently, avoiding large gatherings. And a large gathering is 10 or more people. And we're going to talk a lot about that, and staying home when you're sick. And we'll talk more about that regarding what is sick, what are those symptoms, and what do we mean by what level of symptoms do we need to stay home. As we've talked throughout the pandemic, there's 3 major metrics that we're asked to follow and monitor by the State Health Department. The first one is that 14-day case rate per 100. Earlier today, you saw our rates go up to 179 per 100,000. That's in the red. That's high. We were enjoying back even in July 70 to 80. Back in June, we were below 50 per 100,000. So we've done this before, but we have got to turn this trend down. If you jump on our dashboard, you'll see that we've moved into the red category again for high, and we'll talk a little bit about what that is, but one of them is the case rate per 100K, and that is something we have got to flatten the curve and bring back down. One of the positive areas is our 14-day positivity percentage. We have enjoyed a low percent positivity throughout the pandemic. Even at one point, Governor Polis acknowledged Larimer County and the hard work we've done to make sure we stay low below that 5%. And that's the threshold from Level 1 to Level 2, is we've got to maintain below 5. However, we've been slowly creeping up over the last 2 to 3 weeks, where we were 2.2 just back a couple weeks ago. Now we're at 3.9. So we are creeping up there, and that is concerning. Now, part of how we've been doing so well with the test positivity percentages are robust specimen collection and laboratory testing. and that's a partnership with UC Health, Banner Health, Kaiser, Salud, Colorado State University, and Colorado State Department of Public Health and Environment, and our community-wide testing that we offer 3 times a week, 2 times in Fort Collins and 1 in Loveland. That has really, really helped us in testing, and we'll talk more about that. And then the other part is our hospital capacity and our hospital utilization, and that's an important piece of our metrics. Currently, if you look on our dashboard, our hospitals are reporting treating 21 patients in the hospital. That is up from 3 weeks ago, where we were only treating 4 to 5. So we are seeing that increase slightly with COVID patients being treated in the hospital. Our IC utilization on our dashboard did jump back up into the red at 91%. I am in constant contact with Kevin Unger with UC Health and Margo Carson with Banner Health. What they told me is a combination of 3 issues that we're seeing with our ICU. One is trauma, accidents, just the typical items that would get a person into the ICU, unfortunately. Also, respiratory issues, not related to COVID, but related to our wildfire smoke, has really been very detrimental to people's health, and it has led to an increase in ICU, as well as we're seeing an uptick in COVID hospitalizations in Wyoming, Montana, and South Dakota. So we are treating patients that have been transferred from those states within our hospital. So that ICU utilization, it's not just COVID-19 related, it's those 3 major areas that I just addressed. When we talk about hospitalization, Larimer, as I said, not all hospitalizations are Larimer County residents, and this is fairly typical. We have a very robust medical system here with UC Health, Banner Health, and Kaiser. But we are seeing an increase in transfers, not only from the 3 states I mentioned, from northern Colorado. So we have to make sure we have the capacity in our medical system to provide that care. And again, not all hospitalizations, there are some confusion. Not all hospitalizations are COVID patients. We got to make sure there's hospital capacity to treat day-to-day heart attacks, strokes, other illnesses. And so that's an important piece when we're looking at our IC utilization and the % hospital utilization. Testing, as I said, this has been something that I would say great accomplishment for Larimer County and all of our partners. You recall back in March, I was frustrated that we could only test 30 to 50 people total in the county. Whereas you'll see last week, we made a record of testing over 1,600 people in one day. But testing demand is up across the county and in the state. And so that we're known people are showing more symptoms, and we're having more close contacts with people that are positive. We'll talk more about that too. But what's real exciting, I'm able to report to the council, is our testing turnaround times have totally decreased. 85 to 90% of our results are returning in 3 days, with many of them 1 to 2 days. And that's so important when we're doing contact tracing and getting our schools open for in-person learning. So it was a couple months ago, I was reporting that the testing turnaround was lagging up 7-10 days. We are not seeing that anymore, and that's a great partnership with Colorado State University's vet diagnostics lab that's doing many of our tests here locally, and a private lab in Boulder in the state health department, and our other private labs as well. So contact tracing, I want to spend some time on this. I spent some time on this last week during our community update. Contact tracing is the key strategy for preventing the further spread of the virus. We have trained contact tracers making calls to people and asking questions and letting people know they may have been exposed to COVID-19 and should monitor their health for signs and symptoms of COVID-19, and helping people who may have been exposed to COVID-19 get tested. But I'm asking, please answer the phone. And I'm also asking you to be nice to our contact tracers. What we're starting to see is an uptick of people not answering the phone, not returning their call, not being kind, not answering the questions. What happens is then we're unable to isolate and quarantine. Our contact tracers are trained, they're empathetic, they're not judgmental, and all information is kept private. But if you're not answering our call, if you're not answering the questions, then we don't know who the close contacts were. And I will tell you, that is driving our case rates up, because back in June, only 5% of the people we called for a case were refusing to talk with our staff or not answering our questions. That's gone up 10 to 15% on any given day. And that's making contact tracing very, very difficult. Also, back in June, when a contact tracer would contact a positive, was usually 3 to 5 close contacts that we needed to follow up and maybe issue quarantine orders on. Now that's grown to, on some cases, 10 to 15. That's meaning our guard is down and we're expanding our bubble, thus leading to this very significant increase in our case rate. I tell you, and I ask and I beg and I plead here, please answer the call. Please answer our questions. Again, this information is kept confidential, and I get it's tiresome, and I get that you don't want to, point out other people. But if we don't, we're going to continue to have the spread, and then we're going to move to level 2, which is going to impact all of our activities and our businesses. So the more we work with our contact tracers, and the more we isolate and quarantine, we're going to reduce the rate, just like we did back in May and June, and we did again in July. Now, here's a slide that's very alarming that just came out today. What I'll explain that on the left here, you see the rate of positivity from 0% up to 6%. On the x-axis, you see our age groups, our ages by groups. The blue, that's the week of September 30th, and the yellowish color is the week of the 14th. Let's look at our 6 to 11-year-olds. We were, for the most of the pandemic, positivity for testing has been under 2%, rather low, but has shot up recently to 5% for that age group. Our 12 to 17-year-olds, our middle schoolers and high schoolers, 3% to over 5%. This is now concerning because that's more than what the state allows for level 1 as well, not just cases, but our percent positivity. Another one is our 24 to 29s, went from 1.5 to over 4. And we're also seeing our middle age, 48 to 53, there's a significant increase. Where we don't see the significant increase is that back to the 18 to 23-year-olds that a couple of weeks ago was about 50% of our cases. And we've been really working closely with Colorado State University and Front Range Community College and others to really provide good outreach to that group. That percent positivity is only slightly increasing. And in our seniors, our most vulnerable, we're seeing even a decrease. So that is actually good news. Our 78 and olders, that percent positivity is slightly decreasing. But the concern is here, pretty much all age ranges, we're seeing a significant increase in our percent positivity. Now, we've been talking quite a bit about the 18 to 23-year-olds, and there was a good reason why. Back on September 25th, that age group alone was making up more than 50% of our cases. Well, that's changed significantly to where it's dropped back down to around 31%. But as you see, all other age groups are climbing back up to the 68, 69%. So I'm going to have to ask all age groups now to make sure we're following this tiresome practices of social distancing, face coverings, hand washing, no large groups, so we can start getting the trend of all age groups going down. Some more trends, cases are rising like I showed in every range, particularly again the 18 to 24-year-olds. It's slowly decreasing at least the last 7 days. Our 45 to 54-year-olds and recently the 12 to 17-year-old. When we dive deeper into the data, Fort Collins looks very different from the rest of the county by age. 2 weeks ago, 50% of Fort Collins cases are 18 to 23 compared to 15% of Loveland's cases. Now, I would say that's dropped in the last 7 days to around 35, 40% for Fort Collins. However, Fort Collins looks very different when you look at just specifically age groups. Also, we're seeing fairly significant increase in the Loveland area, about 28% in case increases over the last 14 days. And we're seeing about a 21 to 22% increase in Fort Collins. So increasing in both our largest cities. Now, our smaller cities, we're not seeing near that increase. Estes Park's had a slight increase, but overall it's pretty minor. And same thing with Berthoud, Wellington, and Timnath, and there are other smaller jurisdictions. So most of the cases we're seeing are in our larger cities, and that will get to our larger gatherings, typically where that is within a larger city. One thing I would mention when we talk about these gatherings is it's not really big gatherings we're seeing. It's not 50 to 100 gatherings of a large party of such. It's more of a moderate-sized gathering, probably 5 to 15, where we're now taking those gatherings from outside into indoors. Studies show that the respiratory droplets in COVID-19 spread about 18 times more indoors than outdoors. So moving indoors with the winter months, we're starting to see the increase in cases. Where we are from our contact tracers, seeing about 20% of our cases that are talking with us, it's these more medium-sized gatherings. So that's where we're seeing person-to-person spread within these gatherings. Now, this is something that we've just been able to kind of extract the data, but looking at symptoms, and we're under 18 and then over 18 are adults. A couple of things I want to highlight. Fever is actually higher in our under 18-year-olds here in Larimer County based upon our data. Slightly, but just a little bit higher. One thing I found very interesting was loss of smell or taste. Much higher in adults than under 18, where 27% adults versus 12% under 18. Now, here's where we get into the more severe symptoms. The cough, then the headache, and the fatigue, much greater in adults than under 18. So many of these under 18-year-olds don't know they're sick or they're slightly sick with maybe the runny nose that you see there at 21%. But even shortness of breath is a lot less for our younger population than our older population. So what we are also seeing is about 1 in 4, so 25% under 18 are even asymptomatic. They don't show any symptoms and really don't know that they're spreading the virus. So that's why face coverings, physical distancing, and no gatherings is so important with this virus because of that asymptomatic spread that we talked about. So here's the importance. Next steps and really call to action of our community again. Our community-wide mitigation plan was submitted to the Colorado Department of Public Health and Environment Tuesday, October 13th. That plan is put together by many of our partners, as I mentioned early on. And there's some parts in this plan that we've kind of ratcheted up. One is really focusing on the 18 to 23-year-olds, and now even the younger, the 12 to 17-year-olds. How do we provide good outreach? I'm sure it's no surprise that age groups don't pick up the newspaper and read it. It's more of iPhones and social media, smartphones, or we're working on geofencing and other ways to get the message out to that age group. We're also going to be looking at other age groups as well. How do we get the information out to encourage people to follow the safe practices? We're also working with our code enforcement, the sheriff's office, on outreach and compliance, and at times, if need be, in enforcement. We are having some resistance for quarantine. People, I understand, we've got to work. We want to get our kids to school. But if they're in those environments spreading the virus, we now have an outbreak. And our outbreaks are increasing in the county. So we've got to stay isolated if we're sick with the symptoms, and we got to quarantine if we're a close contact. We'll have weekly check-ins with the state. Our first one was today. I'll be honest, it wasn't good. We have to turn the numbers down immediately, and we've got to make sure everybody understands what's causing the spread of the virus within Larimer County. Now, we're not the only county seeing this. 14 other counties had to update their mitigation plans. We've got counties that even got Protect Our neighbor status, such as Mesa County, that has also seen a surge in cases. So it's not only us, it's statewide, and as you read nationally, it's nationwide, and that's partly due to the change in weather, and then we're all moving back indoors. So the clock started 14 days back on October 13th. 14 days is coming up pretty quick. Together, we got to work together. We've got to make sure we're bringing those cases down. Now, the state's not asking us to be down to 75 per 100,000 in the next week or so, but they want to start seeing a decline in our cases. And that's the key, what we got to start doing. So here's the strong ask. And I know you've heard this before, and many would say it's the rhetoric, but I can't stress it enough. Wear your face covering. This protects the people around you. I remember back in May and June, I'm a runner, and people were wearing them pretty much all the time, or at least they'd have it close. It's hard to run, but you'd put it over when somebody came close to you. We got to go back to that. We have to go back to that. I'm not seeing that right now. I see that we're pretty lax with the face covering. We got to keep our bubbles small. What do we mean by that? Who's in your close contacts that you know and trust that they have small bubbles? So I would think about it today, if you were called by one of my staff and they said, you tested positive, how many people are close contacts to you? You want that number to be 4 or 5, not 10, 15, because that increases the potential of the spread. Answer the call, please answer the call. We've changed the numbers so it'll come up health department when you get a call from us. It's 15 minutes at the most. We want to know who may have been exposed, where may have you been exposed. We need to learn where the virus is being transmitted. If we don't hear from you, then we don't know. And then that goes to community-wide spread. Stay 6 feet apart indoors, 6 feet apart, even with a face covering on. It's so important. Stay home when you're sick, even with minor symptoms. If you saw on the slide prior, runny nose is a symptom. Now, that's been difficult with the wildfires, I understand. But if you've got any of those symptoms and they're continuing symptoms, go get tested. We've got robust testing here. If you don't know how, get on our website, larimer.org/health, click on COVID-19, click on the testing icon. You can see where all the variety of testing sites are in the county and what days we provide the testing. We need you to get tested. And if your child's ill, please do not take them to school. That can lead to an outbreak in our schools. And get your flu shot. Now, flu shot's not going to prevent you from COVID-19, but it's going to keep our hospital beds available. So definitely that time of year, get your flu shot.